This episode is brought to you by Island. Today's healthcare staff needs safe, convenient, and dependable access to patient data across various applications. Island, the enterprise browser, simplifies and secures healthcare data access. It's a new take on the most common application we use every day, the web browser, tailored for the unique demands of healthcare. Clinicians can safely log in from any device to interact with HealthSystem applications and PHI. Built-in last-mile controls keep data where it belongs, so access is simple, data is safe, and patient care is smooth. Visit thisweekhealth.com/island to see Island for yourself.
Today on UnHack the News.
What good is security if all it does is stop people from doing their job or make people find workarounds to do the things they need to do to get jobs done?
Hi, I'm Drex, a recovering healthcare CIO and longtime cyber advisor and strategist for some of the world's most innovative cybersecurity companies. Now I'm president of This Week Health's 229 Cyber and Risk community. And this is UnHack the News, a mostly plain English, mostly non-technical show covering the latest and most important security news stories. And now, this episode of UnHack the News. Welcome to UnHack the News. I'm Drex, and with me today is Christian from Island. I'm really glad you're here today, Christian.
Thanks for having me, Drex. Always a pleasure.
Always a pleasure. We schemed around a little bit over the last week or so about some of these stories. As usual, we will probably talk about the stories. We'll talk about a bunch of other stuff too, because that's just how it is when we're together. The first one, it's from TechCrunch, and it's about Optum. And the story is the healthcare giant Optum has restricted access to an internal AI chatbot that was used by employees after a security researcher found it publicly accessible online, and anyone could use it just through a normal web browser. This is just, there's so many things that are happening with Optum and United Health. And this was just another one of those stories that I'm like, come on. What was your take on it?
I think the rise of AI in itself is going to change the way everyone works. And one of the challenges that we have is to make sure that data that doesn't belong there doesn't end up there, or at least you have the ability to control where that data can transition to. I think one of the big conversations we have is around AI and how that, whether it's chatbots or LLMs, where does IT governance where can they take hold? How can they control all this spanning? Because again, you have researchers who are hitting various LLMs, they're dealing their own, their private consortiums that may have their own solutions. How do we as an organization look out and try to find ways to put some guardrails? Again, I said this before, taking the sharp edges off of these interactions is important on security. My life has always been more on the operations, infrastructure, application delivery, and being able to layer on security where we can, but it's also about not disrupting those workflows. Because again, what good is security if all it does is stop people from doing their job or make people find workarounds to do the things they need to do to get jobs done? When we start talking about the way we look at it is being able to give those organizations control of where that data can flow to. So if we identify patient data flowing into an LLM that may not be allowed, we can redirect. We have controls of that, essentially that presentation layer, or even hits anything. We can examine data and make sure it's going to the right places, or the places that you define as the right places at least, and give a little bit more control. But at the same time, we're not saying no, you can't use this. You can't use it. We give you the ability to, I would say, redirect them to the appropriate use cases when those choices come up. Because again, you may be using ChatGPT or some other AI bot internally, but they're prescribed for certain use cases. And if you're using multiples, all of a sudden you may be copying, pasting stuff into the wrong one just by happenstance. So how can we help organizations try to figure out a way to better control that and identify where the data should go? And if it's hitting the wrong spot, redirect them to the appropriate spot to make sure that protected data stays where it should.
It's interesting, this particular story, it's really about a misconfiguration that exposed an internal AI capability. There's another story that I'm going to talk about in the 2-minute drill this week that is about, we talk about bring your own device and the challenge with bring your own device. This story creates this new term that I've never really heard before, but it's a thing that you're talking about right now. And it's BYOAI, right? Bring your own AI. And this is exactly what you're saying. People who work in health systems who are just trying to get the job done. We've seen it over and over again. It's the evolution of, probably the wrong term to use, but it's the evolution of the IT hobby shops inside of our health systems that have occurred from time to time and had to be sorted out to understand what it is that you really need and why can't you get it from the central standard sort of system that is more secure and adheres to the architecture and all of that. This bring your own AI problem, I guess it's a problem. It's definitely a problem if you're doing the wrong thing with it, right? And that's what we see, exactly what you were describing, like people trying to get the job done and they're putting stuff into the GPT online that's probably not stuff that should be shared outside of the organization to whatever, build a business case, write a report, create a PowerPoint deck, all those things.
Lines of business trying to do what they need to do to get what they've been tasked with. I think the other piece that ways that enterprise browsers in general can help is one of the things that we have a lot of conversation with the customers is that these are enterprise apps. How do we separate them? How do we make sure they may be accessible by the internet, but we don't want to allow that?
And there's
So
so many of them now too, to be able to say you would just have a full-time person just blocking these individual things if that was the strategy.
there's multiple methodologies. Like we can allow only access through our browser to these corporate resources. So that could solve one of the problems we talked about, just internal app that somehow leaked out. But there are ways that we can configure our system to say these specific solutions can only be accessed through the Island browser. Someone spins up Chrome instance on their laptop or on their workstation, they won't be able to connect to those instances. You can do some call it browser enforcement, where you can limit what you can access. So if you only want your enterprise apps to be able to be secured through Island Enterprise Browser, you have the ability to lock it down so those applications can't be run anywhere else if you wanted to. So there's various ways to handle that, but I think you're right. It just, how do you stop people from spinning up instances, especially when you're BYOD environments where we're seeing a lot of, or your BPOs where organizations may have the ability to support those AIs locally, but you don't want to have your data interact with them. So it's becoming more and more complex as AI gets traction in the industry.
There's another story that you sent to me that you said you thought was interesting, and it's about the Mount Nittany Health fine, $1.8 million to settle an online tracking technology lawsuit. This is tied back to the use of those online tracker technologies that are embedded in websites that report out where folks are using the website, where they come from. Sometimes it collects personal data. It does a lot of things that most people don't know is even happening when they visit those websites. What's your take on that?
Well, I think that was going back into really understanding what drove the development of Island. I think that was one of the key facets that enterprises were challenged with. Nothing against Chrome or Edge, but their main business line is commoditizing the end user, understanding where they're going, what data they're interacting with. And not only that, but then you have this kind of general plugin challenge or extensions that get pulled into browsers. How do you control the exfiltration of data? So that's really where I think the precipice of Island was. Let's take all the things that are great about the browser and let's remove all the things that make it a non-enterprise application. So those tracking pieces, being able to control those extensions, be able to control those plugins at a browser level from an enterprise, that really changes the way that organizations can trust interacting with websites. So I think for us, it's always about how do we give the enterprise the tools that are required to securely manage these environments and extend out these organizations to be able to trust the browser without having to put on all these various technologies around it. It's really been one of those things that it's amazing where you look at across your ecosystems it could be in healthcare, it could be anywhere else, but you're trusting this kind of commercialized product to be your enterprise delivery mechanism. What's going on behind the scenes?
I get updates and have to reboot my browser all the time, and I know most people do. And I'm also one of those, I have 45 or whatever tabs open at the same time. So it's, oh no, I have to reboot my browser. What am I going to do?
I find it very interesting on how much data, like even we can track metrics of the amount of calls that are happening from websites and all that stuff. I never really thought about it in that manner until we started really tracking it. But when you look at the amount of calls that are happening to the browser from all the websites that you visit, looking for, inspecting previous cookies and all those pieces, the amount of data that you have available from a browser, especially when you're working with PHI or PII or financial data, it's pretty scary. So having some controls around that, I think moving forward is going to be important for organizations, especially with this finding where they may not even have known what was going on. They didn't install a plugin. Maybe they didn't. I don't know. But giving organizations the ability to say, from this point on, we're not going to report any data back to Microsoft or Google or any other ancillary solution that may have dropped a plugin on our device, giving that type of granular control of how users interact with these. I would say all modern apps are starting to move to web and SaaS delivery. So you're going to have some controls. I think that is probably a wake-up call for a lot of organizations, not understanding what's really going on in the mechanics of the browser.
Of the browser, yeah. Our last article today, it's interesting because we can go almost anywhere with it. Humans are IT security's weakest link. It's from ISACA, and there's just a lot of great stuff in this article. But humans are humans. They make accidents. We put technology around them to try to protect them. And it's almost I'm trying to think of the saying, you try to foolproof things, but the fools are pretty ingenious. And that whole challenge around humans, we both have worked on that issue a lot.
I agree. I think that is one of the challenges that I've struggled with throughout my career is being able to enable users to interact with the technologies they need to, and hopefully give them the tools that are required to do that. But unless you are actively in, I was lucky enough to have the opportunity to work at elbow with doctors and nurses and physicians across our specialties to understand what their needs were, whether it was specific device types, how their workflow should be done previously. But you're always going to find, whether it's shadow IT or just operational kind of initiatives that change the scope of what they're doing, bringing in their own tools, downloading plugins, or whatever it may be. It's always challenging to be able to secure the data in a way that allows them to do their work, but also at the same time protect your organization and the patients that you're supporting. It's one of those continuously changing landscapes that IT is. I think we need to spend more time understanding our users' needs because, like you said, oftentimes users are just this doesn't give me exactly what I need, so I'm going to do X, Y, and Z outside of it. And all of a sudden you lose insights into what they're doing. It's not so much a rogue action. It's just they need to get the job done. So I think, giving them the tools that are required and having that open communication line with your operational teams.
The communication that's the key. That's the whole key to the whole thing, right? Is that if they feel the need to go outside of the standard built stuff that you have, let's talk about why you feel the need to go outside. Come to us and talk to us and help us understand that so we can build something that works for you. Or maybe a capability that we've given you actually will do that. You've just never been trained on how to do it. These articles to talk back to the human-centric approach to IT security. I actually had a friend of mine posted something about this, and that kicked off a whole conversation, and that kicked off a whole back channel, bunch of conversation. A lot of these articles talk about just make sure you use MFA and those kinds of things, and that's all great. It really is, and you should be, absolutely. And then you start coming up with edge cases, and people are like, oh, but that's an edge case. And there are lots of edge cases in our business, and trying to figure out how to scoop all those up and keep them from happening, or letting them happen, but doing it in a safe way is tough to figure out.
I think the other piece is, at the end of the day, the doctor, the nurse don't care about, and I know it's everyone's responsibility for security, but I can remember when we first brought EHRs into the doctors, into the nurses, I would say the overall sentiment towards it was this is a barrier for healthcare. So we have to understand from their point of view, what is their main task? Now, all this other stuff gets in the way of that. So we have to make it as seamless and as painless as possible. Again, some of these things are just mandates from our orgs and from healthcare regulation agencies. So we've got to work with them and like HIPAA guidelines. They always tell you got to do X, Y, and Z. They don't prescribe to you, do step one, step two. It's just like you get these kind of ground rules, make it happen. But and the funny thing is that what I've experienced over my time frame, and I talked about this a little bit earlier, standing up an oncology program. The needs of those doctors are so much different than the needs of an internalist or a cardiologist. You can't just build this blanket kind of workflow for everyone. You have to really focus on what are their requirements and work with them to define those up front and say, okay, now this workflow is a lot different than, again, a cardiologist. So how do we have a malleable process to be able to deliver what they require at the same time meeting our general security and data governance requirements? So it's always a moving target, and it's always something that, it's going to require a lot of interaction from various teams within IT to be able to support those, or else again you're going to have these fringe work cases or people downloading stuff to their local PCs because they can't do the things they need to on their enterprise devices. And it ranges from there. I can remember early in my days just walking through in the biomedical engineering teams before they actually reported into IT. The amount of like skunk works, shadow IT stuff that was going on there almost made I'm like, how? Walking into a broom closet and seeing a server, I'm like, what is this server doing here? Yeah. And then you finally trigger it down through our network. I'm like, all right, this is tying back to our neonatal unit. How are we gonna? So it's those things where all of a sudden you as an IT organization aren't giving them what they need. They'll find a way to make it happen. Again, I think it's one of those things we're going to be continuously battling with as we manage this kind of very intricate relationship between the clinical side of the house and what the back office and IT requirements need. So overall, it's fun.
Yeah, it is fun. Communication is key to the operation, as you said. I think that's the bottom line. Thanks for doing the show today. I really appreciate it. It's good to see you.
Good to see you as well, sir. I'm always glad to have a conversation with you. Hopefully we can do some more of these soon.
I'll see you on the road in 2025. We'll be at all the big places and, of course, all the events. I'll catch up with you there.
Yes, sir. Thank you very much.
Thanks for tuning in to UnHack the News. And while this show keeps you updated on the biggest stories, we also try to provide some context and even opinions on the latest developments. And now there's another way for you to stay ahead. Subscribe to our daily insights email. What you'll get is expertly curated health IT news straight to your inbox, ensuring you never miss a beat. Sign up at thisweekhealth.com/news. I'm your host, Drex DeFord. Thanks for spending some time with me today. And that's it for UnHack the News. As always, stay a little paranoid, and I'll see you around campus.